You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with periodontal disease. If you have bleeding gums, red gums, and bad breath, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that have periodontal disease. With us we have Dr. Gordon Wilson. Dr. Wilson, welcome to the program.
Oh, thank you, Randy. Thanks for having me.
Now, before we get into today's topic, and we've had you on the program before.
Correct.
A lot has changed, by the way. I guess you've treated hundreds of people,
Probably thousands of people by then.
With periodontal disease. Is this your focus? I mean, is this what you like to do?
This is probably this is definitely the majority of my practice. I would say I probably do about 60% treatment of gum disease. The other 40% is doing cosmetic dentistry.
So who is your typical patient that you see?
A typical patient for me might be somebody age 30 on up who has red, swollen gums. Maybe they're...
I mean, that's a big sign right there.
It's the biggest sign, yeah. Bleeding is the biggest sign. You know, maybe they have bad breath. Maybe they haven't been to the dentist in a while because they've been told they have gum disease and they just don't know how.
You say there's a lot of people that have been diagnosed with gum disease or periodontal disease and then they do nothing about it. Mm-hmm. You know, they don't go to a dentist to have treatment. Well, what's the fear? What's the problem?
Yeah, I think the three main reasons that we typically hear in our office is that maybe they didn't know that they had gum disease. Or when they found out that they had gum disease, they were afraid to do anything about it, or they just didn't know what to do about it.
Now, has a lot changed over the years, in the last 20 years when in treating gum disease?
Over the last 10 years now, I've been using a procedure known as LANAP that uses a laser to treat moderate and severe periodontitis in lieu of using a scalpel and stitches.
Okay, now, you want to make it clear to me, you say that you're not a periodontist, but you've been doing this for how long now?
Over a decade now.
Okay, let's start with what is periodontal disease or gum disease. What is it?
Well, periodontal disease is an infection of the teeth, the gums, the bone that hold the teeth into place.
How do you know if you have it, by the way? Well, what are the symptoms?
Some of the symptoms are, of course, bleeding gums.
But doesn't everybody have a little bit of bleeding gums, though? I mean, when you floss, they're going to bleed a little bit?
They do, but that's not normal.
Okay.
Like we mentioned before, I mean, if you were to wash your hands and they were to bleed, you wouldn't think that that's normal.
So your gums really, when you floss, should not bleed?
They should not.
Oh, interesting.
Healthy gums are pink, they're firm, they're stippled like the skin of an orange, and they don't bleed.
Okay, so bleeding, number one sign, what else?
Bad breath, red, puffy, swollen gums. Usually there's no pain. Unless it gets advanced into the advanced stages of moderate and severe periodontitis. Sometimes there are changes in the spaces between your teeth, which indicate changes in the underlying bone. In fact,
so the teeth start to move?
Correct. Just last week we had a patient in our office, and she'd come in, and when I sat down to do the exam, she had told me just how thrilled she was that she came to see me about a year ago, and we did the laser procedure on her. And she said that her gums had filled in. Now, I questioned it because I didn't remember what her teeth looked like before, but we'd actually taken a photo. When I looked at the photo, she was right. She had spaces between her front four teeth. And she was told that she was going to lose all four of those teeth. She came to me, we did the laser, and just last week her teeth had actually shifted back together. It almost looked like we'd done orthodontics on her.
All right.
Her smile had improved, and I wouldn't have believed it if I hadn't seen the picture myself.
What happens, and let's talk about treatment options. There's traditional treatment options, which is what? Surgery.
In the early stages, in the gingivitis, which is the first stage, it's the only stage that's reversible, and then in the early periodontitis, those are treated with a procedure known as root planing. That's
root planing.
Root planing. Okay. Scaling and root planing.
Describe that.
Let's say that a routine cleaning is where we go in and we clean the teeth above the gum line.
Okay.
Okay. Root planing is where we anesthetize the patient.
All right.
We go down below the gum surface and we remove the calculus from the root of the tooth. And that's very effective for 4, 5 millimeter pockets, sometimes 6 millimeter pockets as well.
Now, what about more severe cases? And what defines a more severe case?
The periodontist will do a procedure known as flap surgery. Where,
describe that.
Okay, basically what flap surgery is the periodontist is going to make an incision along the gum line, okay? And then what they're going to do is they're going to separate the gums from the tooth and the bone to create what's known as a flap. And what this does is it gives the periodontist direct vision so that they can see, they get better access.
So is it bacteria?
To the infection.
Is it plaque? What is it?
What's that?
The infection. I mean, what is it?
Well, the infection starts off as plaque.
Plaque.
Okay, and then your saliva.
Is tartar and plaque the same thing, by the way?
No, plaque is the thin, sticky film of food and bacteria that form on your teeth constantly.
Okay.
Okay. This calcium in your saliva hardens the plaque and turns it into what we call calculus, but it's also known as tartar. So tartar is basically hardened bacteria.
Okay, so when it goes under the gum line, that's when you're in trouble.
Right, because it progresses. What it does, it kind of snowballs. It kind of progresses right down the root and just.
So the surgery, and it's called root planing.
No.
No.
The non-surgical pocket reduction is called root planing. The surgery, you know, it can be called flap surgery. It's also known as osseous surgery.
So for people with advanced periodontal disease, the standard procedure is surgery.
Correct.
So they cut away the gums,
They
will scrape.
Correct.
What do
They'll
they
make
do?
an incision.
All right.
They'll separate the gums from the bone in the tooth so that they can get direct access to the tartar.
Okay.
To remove the tartar, okay, which again is the source of the infection. So they want to get that tartar off of there, and then they'll stitch it back together and probably put a periodontal dressing on it or something like that.
Okay, the other option, that's one, is surgery. What's the other option?
There are several other options. The primary one in my office is a patented procedure known as LANAP. And what we do with LANAP
That's a laser?
That's using a laser to go in and selectively remove the diseased gum tissue and kill the bacteria that are causing the infection.
Is this virtually a bloodless surgery then?
No.
Is it even called a surgery?
Yes, it's a surgery. But it really doesn't seem like a surgery because it's so minimally invasive. And so I've got thousands of patients who are coming in to see me to have the gums treated, and they're coming back after we've treated them to do our periodontal maintenance appointments, and the bleeding is gone, the swelling is gone, the bad breath is gone, you know, and the gums are healthier and the patients are happier.
So you have patients that dealt with bad breath for 10 years plus, bleeding gums for many years.
I've got people who come in all the time, and so often they'll come in and they'll say they haven't been to see a dentist in probably 5 to 10 years, and so you know there are a lot of different issues going on in their mouth besides just the gums. But of course we're going to focus first on the gums, get the gums healthy because we want to get a good foundation. Once we've got a great foundation, a nice healthy bone, nice healthy gums, and the teeth are now solid instead of loose, now we can build on that.
So loose teeth become a little stronger?
Loose teeth, yeah.
After periodontal treatment?
After my LANAP procedure.
Okay.
What happens is somebody will come in, and I cannot tell you the number of people who have come in and said, you know, the dentists want to take out 6 teeth or 8 teeth or whatever. And we'll go in and we'll treat them, and they keep all their teeth. We're treating people with lasers. We also have a new system that's a patented appliance where we put a medication in there. That appliance directs the medication directly to the source of the infection, and it allows the patient to now take command of their disease. And we're seeing even
So it's like
better
medicine
results.
that treats the disease.
You know, I would
kills
say
the bacteria?
Kills the bacteria almost as effectively as the laser. Now, sometimes there's so much bacteria in the gum tissue, the gum tissue is so laden with bacteria that I still have to go in and use my laser. But I can tell you right now, I'm not using my laser nearly as much as I used to because I found that these new trays can actually treat the disease up to 6 millimeters without the need for my laser. And that means more comfort for the patient. It means faster healing time.
Less expensive.
Less expensive, and patients are much happier. Periodontal disease, you have to think of it like diabetes or heart disease, okay? There is no cure for it, but you can control it.
Well, how often do you have to get treatment then?
In my office, you get treatment one time, and then you go on these periodontal trays, and that helps you maintain it. And you know, we're seeing the bleeding go away. We're seeing the swelling go away, the bad breath go away, the pockets, the decrease in depth and number. And
now, on this show, we always have to say, you know, and this is a real interview. People that are watching this, there's no scripts. No. This is your truth, your opinion as you see it.
This is what's going on in my office.
And this is what's going on in your office. And so we always have to say results aren't typical. But are they typical with you? I mean, do people get better?
You know, I got to tell you, it's really frustrating for me as a dentist when you go in and you treat somebody and they get phenomenal results. And then you're going to go in and you're going to treat somebody else and then they just get good results. You know. Why
does that happen though? I mean, if the laser is killing the bacteria, cleaning it up.
You know, medicine is not an exact science. And so it does get frustrating for me, and that's why I went and sought out these perio trays, because now what I'm finding is that even what I'm doing is I'm using the laser.
So combination therapy.
It's combination therapy. I'm using the laser in conjunction with the perio trays, and I'm getting even better results still. You know, the bleeding is now almost completely gone.
We're going to take a quick break. We come back, more about the process for people with gum disease. You're watching The Wellness Hour, leader in medical news and information. We are here with Dr. Wilson, and we're discussing what you need to know about periodontal disease. We'll be right back.
The World Health Organization 2003 report indicates that over 85% of adults in the United States have gum disease. Most don't even realize it. In the beginning, the symptoms can be slight. A little bleeding when you brush your teeth or puffy gums. But if not dealt with in the early stages, periodontal disease can lead to receding gums, lost teeth, and chronic bad breath. Studies have also discovered an association between infected gums and heart, lung, and circulation conditions.
Nobody had ever told me that I had a gum disease.
And I noticed then all of a sudden my gums starting to recede.
And my mouth didn't feel real clean. So I thought, well, maybe there's some gum disease going on that I don't really know about.
So what exactly is gum or periodontal disease? How does it develop, and what can you do about it? Between your teeth and your gums is a small valley called the sulcus. It's only 1 to 3 millimeters deep. Brushing and flossing usually keep this area clean and healthy. There are special cells in the sulcus that form a fluid like saliva that flows out of the pocket. This is called crevicular flow and helps keep the area clean too. If food, plaque, or tartar build up in this area, the gums become infected. They will appear puffy and become tender. This early infection is also called gingivitis and can progress to periodontitis. Unfortunately, most people will decide it is too painful to brush or floss the swollen gums, and this just lets the infection continue. As the infection worsens, the gums become even more inflamed, and the infection involves the bones supporting the teeth, and the teeth become less stable. The infection increases, and the ultimate result is the loss of bone, teeth, and gums. Once infected, what can you do?
I've been seeing a dentist every 6 months for as long as I can remember. Taking care of my teeth, brushing every day, twice a day, flossing my teeth, thought I was doing all the right things. Knew that my gums were bleeding, but wasn't too worried about it. I thought flossing will take care of that. But when I went to see him and he runs all the tests on you and shows you all the calibrations, then I definitely had periodontal disease.
I had good dental hygiene and did not expect to have gingivitis, but I did.
Certainly, brushing and flossing continue to be important. But if you have periodontal disease, you will need professional treatment from your dentist. Dentists have many options when treating your gum disease. The standard cleaning procedures called scaling and root planing can help to remove plaque and tartar and reduce some of the bacteria involved. Often the disease is extensive enough that this is only a partial solution. Surgery is another option. The diseased tissue is cut away, then sutures and a surgical dressing are used. Unfortunately, if the home care is not changed, the disease returns, and often the patient must repeat the process years later.
The surgery is so arduous. It's not just an appointment and you're done. It's 4 appointments, and you have the surgery, you have sutures, you have to go back a week later and have the sutures removed, you have a recovery process, and then you do it 3 more times. And that's very difficult.
Then there was limitations as to what you could eat and drink for several days, and there was some pain involved.
It's a very expensive process, too.
Since the condition is an infection, many dentists have attempted to place antibacterial medications in the sulcus to help kill the pathogens. But remember the crevicular flow? That fluid flushes out the pocket almost 40 times every hour, meaning the medicine gets washed away almost immediately. With an increased infection, the fluid flow increases, sometimes as much as 30 times. It is impossible to maintain a high enough concentration of the medication to kill the bacteria, as the medications are constantly flushed out of the sulcus. To work around this, dentists developed fiber strips or small plastic chips that could be left in the sulcus with time-released medicine. While helping to keep the medicine in place for a slightly more extended time period, this still required the patient to return to the dentist every few days for reapplication of the medicine. Not a very practical solution. In response to all these obstacles, a new option has been developed, the PerioProtect method. Using custom-formed trays, antibacterial medication is directed to the source of the infection. The seals in the tray hold the medication in the sulcus long enough to kill the bacteria and control the infection. And by wearing the trays for minutes each day, your infection can be controlled. The PerioProtect method overcomes previous obstacles, is easy and painless, and is a very effective option.
I could do it at home. I didn't have to have an appointment to go see anyone, that it was up to me to actually make sure that I got the process done in the way that it was described. And I found that very attractive. That was something that I could control and that I could do.
The trays are no problem to put in or take out. It is easy, and it works.
While a serious medical condition, your periodontal disease does not have to diminish your quality of life. Now that you understand what is going on in your mouth and some of the options you have, you can take control and put yourself back on the road to a healthy smile.
It's painless, it works.
The end results are just great, so why wouldn't you want to do it?
Good morning, everybody. I'm Marty Velasco-Hames, talking about your dental health today. And wouldn't we all like procedures that help us make us more comfortable and pain-free when we go to the dentist? And that's what we're talking today with Dr. Gordon Wilson. Thank you for being here this morning.
Well, thank you for having me.
He's a dentist here in the Valley, and he's going to show us a new laser that they are using now when it comes to dental care. Go ahead and show it to me.
Okay, well, periodontal disease affects probably 3 out of every 4 adult Americans, and a vast majority of those are moderate and severe periodontal disease, where the alternative...
We're talking gum disease,
Gum
right?
disease,
Okay.
that's correct. So gum disease. So if this is the root of your tooth and these are your gums...
Here, come look over here, Arturo.
Okay,
Go
there
ahead.
we go.
Here's a tooth right here.
The tooth is right here. Plaque forms on the tooth, and calculus, it then turns into calculus, or you've heard it called tartar,
Right.
which then causes the gums to pull away, and you develop what's known as a pocket.
And what are the symptoms of that?
Bleeding gums, they begin to shift.
And they hurt?
No, actually, it's a
Really?
painless disease until it gets to its final stages.
How do you know you have it then?
Well, you have to go to your dentist, and basically we go around and we take what are called periodontal readings and check the depth of the sulcus and see if it's a pocket.
Now one of the ways doctors have treated this in the past, let me just say this, they go in with a knife and they like sort of do a lot of cutting on your gums.
That's right.
That sounds painful.
They take a scalpel and they slice right along the gums to expose the diseased site, to remove the calculus, and then they stitch it back together. Now the alternative is to go in with a little fiber.
And that's Chip there in the dentist chair.
That's
He had
Chip
this
in our
done a
chair.
week ago.
This
And
was
tell
last
me what
Monday.
you're doing.
And what we're doing here is we're going to remove his diseased gum tissue with a laser, and this laser selectively removes diseased tissue from healthy tissue.
Now, there are lasers out there being used in dentistry, but you said those lasers oftentimes take healthy gum along with diseased gum.
That's correct. The next best laser is called a diode laser, and it's more of like a hot knife, so it just pretty much melts the tissues away.
Is that what this is right here?
This is actually my procedure. This is the ND-YAG, and what you're seeing come out of there is diseased tissue. The healthy tissue is being left in place.
All right, now, does he have that numbing stuff on?
He is numb.
Okay.
We did anesthetize him,
Or the
but as
shot
you
or
can see,
whatever.
correct. It's minimally invasive, and there's little to no bleeding, and when it's over with, there is little or no pain at all.
Well, you know what? We'll just find that out for ourselves, Dr. Wilson. We're going to talk to Chip. He's here with us, standing by here with us live. What did that feel like? Go ahead and tell us what it felt like.
I didn't feel a thing.
Really?
Yeah, really. Then listen, I didn't go to the dentist for almost 5 years because I am not a pain guy at all. So, you know, when he came in and he told me about the procedure, like the alternative was to open them up, scrape that stuff out of there, and then put them back together. And then he told me about the laser. I went with the laser.
Yeah, no question.
So there was no pain. He went in there in an hour and a half, did what I guess was normally takes 2 monds to do.
It was quicker, yeah.
Yeah, and instead of having, you know, 3 months of healing time, it's already completely healed.
It looks pretty good there.
A week and a half later.
Way to go. All right, thank you very much, Chip, for being here. And Dr. Gordon Wilson is the dentist here in the Valley, the only one of its kind in Arizona. He was one of the first, like, in the world, you said, to try it.
This is the very first production model in the world.
Now, say the name of the laser real slow in case people want to ask about it.
The Periolase Pulsed ND-YAG.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about new treatment options for periodontal disease. With us, we have Dr. Gordon Wilson. Okay, Dr. Wilson. Okay, so for people that are just tuning in.
Right, okay.
You've got surgery where they open up flaps.
If you have periodontal disease, Okay, if you have the early forms of the disease, gingivitis or early periodontitis, you don't need surgery. Okay, what you need is
just an excess buildup of plaque on the teeth?
Plaque building up on the teeth, and tartar building up on the teeth, and then you're getting shallow pockets. Okay, again,
that's the space around the teeth.
It's the space between the teeth and the gums.
All right.
Okay, the root of the tooth and the gums, and as it gets deeper, it's forming what we call a pocket. Okay, shallow pockets that are 4 and 5 millimeters deep, sometimes 6 millimeters deep, they don't need surgery. Okay, we're able to treat those in my office without any kind of surgery, just using scalene root planing and periotrace.
You just scrape it out of there.
Correct.
Is that what you just said?
Correct. Okay. Correct. And so.
And by the way, that stuff causes the bad breath.
It does cause the bad breath, and so of course the gums are going to get fresher. One of the medications that we use in the periotray actually causes the teeth to become wider as well.
Okay.
Then when we get into the 7 millimeter pockets and beyond,
that's advanced.
That's moderate, and then getting into the severe forms of the disease, you're getting into the 8s, the 9s, the 10 millimeter pockets, that sort of thing. We're going in and we're treating those with the laser in conjunction with the periotrace.
Okay.
And again, the bleeding is going away, the swelling is going down.
And this is an alternative, the laser you're using,
this is an alternative to scalp
the flap.
Stitches. You have a choice. You can go to a periodontist and you can have the traditional scalpel and stitches method.
So we know that the standard surgery works.
It does.
So this is a new option now.
This is a new option.
And you brought a video. Okay. You want to set up the video before we go into it?
Sure, we'll talk about it.
What does this show? What does it show?
This is a 3D animation of what we're doing, part of the LANAP procedure. It's not all of it, okay, because some of the procedure for LANAP also includes fixing the bite, as we talked about, okay?
Okay.
Sometimes when you're getting into those really deep pockets and you're getting the really loose teeth, we're talking about a malocclusion or a bad bite, the way the top teeth and the bottom teeth come together. So a lot of people, if they have crooked teeth, they can kind of know too, they can feel when they bite down, one side hits before the other side hits.
So this is a complicated, I mean, this is a bit more than just, hey, a laser. This,
yeah,
I mean, there's a lot of reasons, I guess.
There are a lot of things. I mean, I've
why somebody has.
In the 10 years of doing this, I've really kind of seen just about everything, you know.
Okay.
I would say the biggest cause is probably the plaque buildup that turns into tartar. So you've got this bacteria where you've got these toxins and poisons that are going into the gums and causing the inflammation. But then when you see when I see people who are in the more advanced stages, in the severe periodontitis, that's where they've got a lot of bone loss and the teeth are loose. A lot of times I'll find that they've got one tooth that's loose and one tooth that has a lot of bone loss around it, but the other teeth don't have much disease around them at all, or maybe even they're perfectly healthy with no bone loss and no pocketing, pink firm gums just like they're supposed to be, but then you got this one tooth that just out of nowhere just is loose. And so we find that that's the first tooth that hit. And so all we have to do is shave that down a little bit, make a little bit of an adjustment, and then that mobility goes away, the tooth stabilizes, and we're able to save the tooth.
Now you have a clip of how the laser works.
Correct. It's a 3D animation. So what we're looking at here is the laser going down into the periodontal pocket to treat the gum disease. Okay. Now I tell my patients that there are two sides to every pocket. You've got your soft tissue side, which is what the laser is addressing right now. It's going in, it's removing the diseased gum tissue, and it's also killing the bacteria that are down inside the pocket that are the source of the actual gum infection. And then you've got your hard tissue side, which is the root of the tooth with all of the tartar buildup on it.
So that stuff dissolving off is the plaque that's on the root.
What's happening right here is we're going in with an ultrasonic scaler, and we are removing the calculus from the root surface, the hard tissue side of the pocket, okay?
Okay.
So we've removed all of the diseased gum tissue so that we've treated the soft tissue side, and now we're treating the hard tissue side. Okay, and that's the thing about LANAP, is that it treats both sides of the pocket, whereas scaling and root planing alone really only addresses the hard tissue side.
Okay.
So now we're coming back in and making a second pass of the laser, and what the second pass of the laser is doing is it's removing any remaining diseased gum tissue that might still be down there, killing any residual bacteria that might still be lingering, but it's also warming up the blood to create what's known as a fibrin clot. Okay, we're creating what we call hemostasis, which is stopping the bleeding. Okay. Now there's not a lot of blood with this procedure, but what little there is, that's actually a good thing, because we want to create that fibrin clot in there, because we call that a closed, sterile environment. What I see happen so many times is people will come into me and they'll say, oh geez, I wish I would have done this 5 years ago or 10 years ago.
Do they say that?
Sometimes. Well, I can't save every tooth. Okay, I can save a lot of teeth, I really can, but sometimes they come in and they're too far gone and I can't save them. Okay.
So when you go in for your annual,
I wish that they'd have come in to see me a couple years earlier, because you know I feel like I could have saved them a couple years ago.
Now you've been doing this, just as a recap, about 10 years.
Over 10 years.
You've been working with lasers, with periodontal disease, and this treatment is becoming more mainstream.
Yes.
It's effective.
It is very effective.
Okay.
It's safe. It's easy. I have a bunch of patients who just are. It's exciting to see patients start to embrace this technology. It's exciting to me because they come back and they finally have some hope, because they really thought that they were that there was nothing they could do. You know?
And it's affordable. I mean, it's and if it's not affordable, you offer
sometimes
payments.
I've been told they need traditional surgery, when actually I can treat it in my office without the laser, even using the perio trays.
Just the trays. So perio trays.
Perio trays.
That's the new hot thing in your office. You love it.
Everybody should have perio trays, even you. You know,
so you say everybody over 40.
My whole office has them
for prevention.
Even younger than that. I mean, 30 years old is where periodontal disease is starting, where we're starting to see the beginning stages of the disease. But now I use the perio trays in conjunction with the scaling and root planing in a lot of these cases, in the early, in a lot of the moderate cases of periodontitis, and we don't even have to use the laser. So that's just makes the patient a lot more comfortable, and they're happier.
So they could go to your website. You have a lot of information about gum disease there.
Talked about today is
so
on the
medicine,
website.
you give people with periodontal disease. Let's say that they're afraid of the laser, they're afraid of the surgery.
Well, sometimes they need the laser. Okay,
but let's say that they won't do it though. Will they still be helped?
Oh,
with
absolutely.
these trays?
Absolutely.
Okay.
And we've got people who aren't as compliant as they should be with the perio trays, and they're still getting results.
How many minutes a day do you have to wear these trays?
Well, it depends on the severity of the infection. Okay. In the milder forms, let's say you have no bleeding and no pocketing at all. You still want to use these to maintain the health of the gums. Okay.
All right.
Once a day for 10 minutes. Okay. Let's say you're at the worst case. You're super severe. Okay. Those patients are wearing the trays 6 times a day for 15 minutes. Okay. And as your gums get healthier, you wear them less and less frequently. Okay. And so eventually you will get to the point where you're using them once a day for 10 minutes.
All right. Well, I want to thank you for coming on the show. Very good stuff.
Well, I appreciate
Thanks for coming back and flying over here and talking about this. Anything new? Anything next? I mean, what's next? I mean, you think the technology's there? It's just getting good.
You never know. I didn't know that these perio trays were out there, and I just kind of stumbled into it. It's just like the laser, you know. I happened to be at the right place at the right time, you know, and who knows? Maybe something's going to come on down the road somewhere and be even better than this, and if so, then we'll be back talking about it on the Wellness Hour.
All right. And do you think the future, 10, 20 years, that lasers will be mainstream and accepted as mainstream in treating advanced forms of periodontal disease?
Without a doubt, I believe it's the standard of care. Okay,
right.
If you have periodontal disease, you need to be given the LANAP procedure as an alternative. Okay, you need to know that this is an alternative to the.
So it's an option.
Surgery. As an option.
Just to look at both.
Absolutely.
Okay, good. I want to thank you so much.
All right, thank you.
All right. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, you can see it on our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.